Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Michael Myers. He's a professor of clinical psychiatry, and he's the author of the book, Physicians with Lived Experience, How Their Stories Offer Clinical Guidance. There's an excerpt from that book on Kevin MD. Michael, welcome to the show.
Thank you very much, Kevin. I'm happy to be here.
All right, so let's start by talking about your book and then the excerpt itself. What led you to write it in the first place?
Okay. This is a book that's been brewing for quite a while, actually, quite a few years, but I really began to really focus in earnest over the last 4 years. And where it comes from is the fact that I've always been very moved by fellow physicians or medical students who have gone public with their stories of living with or being treated for a psychiatric illness. And as you know, Kevin, I mean, we live in a world where there's a fair amount of stigma, including the medical world. And so I see these individuals as really movers and shakers and pioneers in this area. Even though it's been going on for quite a while, there's been more people sharing their stories over the last, I would say, 5 years or so. So
Well, that's wonderful to hear. One of the things I do, of course, on Kevin MD for the last 20 plus years is really to humanize physicians, right? Allow them to
yeah,
show their vulnerability. They write articles, they appear on this podcast, they share their stories. And
that's
we
right.
need to let the public know that physicians are human too. We're more than just our degrees. Now, how
Exactly.
did you find these physicians to interview?
Okay, so I've been collecting stories over the years, the ones that are published, of course, and as you may know, there are a lot of them in JAMA, a Piece of My Mind. That's where I get a lot of them. The New England Journal of Medicine, the British Medical Journal. Every so often, you'll see stories in the Washington Post, the New York Times, the Australian press, because this is a global book. I interview people, doctors from all over the world, for this. And so I just started collecting them, and then I made the decision to reach out to them I was already doing that when I first read the stories to just thank them for writing their story, that they really help a lot of people who are struggling in silence. So with many of them, Kevin, I circled back sometimes after many years to see if they would be interested in being interviewed for my book.
So, any common themes that you picked up from interviewing all of these physicians as to maybe why they decided to share the story and some of the lessons learned from doing so? Any common themes that connect them?
Thank you. Yes, that's a great question. Yes, indeed. One of the most common themes had to do with the fact that this is an individual who is often feeling a little bit better now, or is recovered or recovering, and they learn of someone, it may not even be someone they know, in medicine dying by suicide.
Mhm.
And they just had this feeling of this has got to stop, that we have to speak out about this, because they're aware that a lot of physicians delay getting help or don't get any help at all. And in some of those individuals do end up taking their lives. And so that was a motivating factor for a number of people to go public with the story. There's another theme that came through, and that had to do with really correcting misconceptions, really, about what illnesses are. For instance, depression. So many physicians who have experienced it will say, I thought I understood depression until I experienced it myself.
Mhm.
And what I've realized now is what a real kind of medical illness this is. I mean, I really felt medically ill. And then they, of course, describe a number of neurovegetative symptoms of depression, but they also talk about how important their treatment was, which is often a combination of medication and good psychotherapy that's brought them back to their resting state, or perhaps even to a new normal. So that was another theme. And the third theme had to do, again, with fighting stigma, really wanting to get that out there, as you mentioned earlier, about humanizing medicine, leveling the playing field. And another theme was gratitude.
Mhm.
Some of these individuals have felt that they're the lucky ones, that they actually got help and they're feeling better. And they've known too many in medicine who have not gotten help and are no longer with us. And the final theme would be the ones who have said, this going public like this has really made me a different person. I have received emails or calls from strangers all over the world who have been so grateful for my sharing my story, and it has helped them. Some of them going off and getting care themselves for the first time. And I can't tell you how many said they've received notes from strangers that it said, "Your story saved my life."
Hmm.
That's pretty powerful.
Now, as we know, the culture of medicine, less so today, but traditionally
Yeah.
has been loath to allow physicians to show vulnerability.
Yeah.
When you talk to some of these physicians, how difficult was it for some of them to initially share their story and be vulnerable? Because that's not something the culture of medicine traditionally encourages.
Exactly. Kevin, that's a great question because for most of them, it might have appeared that they just, decided, I'm going to do this.
Mhm.
Most of them did think about it quite a lot. A lot of them discussed it, of course, with their loved ones, their family members, and got mixed opinions, sometimes with colleagues and friends, some with mentors, some with their therapists. And the ones that got pushback, because some did, they might have retreated for a while, but then if that feeling didn't go away, see, actually, that brings me to another point. Some of them felt, you know what? I felt kind of duplicitous.
Mm.
That here I am, a doctor, looking after people. I heard this in psychiatrists, Kevin. Here I am, a psychiatrist, looking after patients day after day, and I'm taking antidepressants myself. Why can't I disclose this?
Mm.
Not to make my story their story, but just to say, look, I get it. I know what you're struggling with. I too have been there, that sort of thing. And so the ones who have been able to do that have just really felt that it's enhanced their, well, what we call in our field therapeutic alliance, what you could call the doctor-patient relationship,
Mm.
that their patients actually have high regard for them to be so honest. And again, without flipping the scales that, the doctor becomes the patient. I don't mean that. It's just got to do with their humanistic approach.
That's fascinating. So by
Yes,
showing vulnerability, by sharing their story, by sharing some of the things that they are going through, in
yes.
some cases that allows them to have a stronger connection with the patients that they see every day.
That's right. Yeah. And the other thing about this, Kevin, as you probably know, because more and more physicians probably come on your show too, talking about self-compassion. That wasn't a term that was really in our lexicon 5 years ago. So it's relatively new. And when people first heard of it, oh, doctors with self-compassion, they must be narcissistic or they must be selfish or just thinking of themselves. It's not about that at all. It's really about treating yourself with the same kind of love or compassion that you treat others, including your patients. And we've now found with some studies that physicians with a higher level of self-compassion actually are, first of all, it really helps them be very authentic physicians with their patients, but they do have a lower incidence of burnout and other types of illnesses just because of that, because they're really taking care of themselves. It enables them, to do better work.
So let's talk about this excerpt that was posted on Kevin
Yes,
MD. It's titled
yes.
Breaking the Silence: Mental Health and Racism in Medical School. It highlights the story of one Dr. Chris Veal. So tell us about that story. And for those who didn't get a chance to read that excerpt on Kevin MD.
Sure. Yeah, Chris Veal. I chose this story because it is so powerful. When I first read about him, again, he was somebody else that I reached out to as well because it was in a publication and it really explained the magnitude of his depression. He was a medical student, really struggling, and was getting into academic difficulty, was developing suicidal thoughts, and as a black man in medicine, in a medical school that had very few black students, he felt almost responsible in a way for his race or his ethnicity as well, that he had to be. So obviously he felt terrible about this. Fortunately, he reached out to his godparents who could tell he was in trouble. They helped him. He took a break from medical school. They got him some care. He got feeling better. And when he got back to the school is when he decided to speak about this openly, because he really wanted to touch upon racial assaults or microaggressions, as we call them, those things that affect our minority students, especially our students of color. and identify them. And by speaking out like that, he's also an openly gay man, so he spoke about that and some of the homophobic slurs and things that he had experienced while a student. So there's a lot of kind of educational material in his piece. He published it when he was a resident, and has received nothing but positive feedback. He's done a lot of volunteer work, including some work with the Dr. Lorna Breen Heroes Foundation, and the other thing too, he's made a short videotape that they use at the University of Vermont for incoming medical students to kind of basically speak about the humanness of our students and that we're here for you. And he's now a primary care physician, I believe, in the Chicago area. So that's why I kind of wanted to highlight his story, that his depression wasn't just sort of like a biological shift. There was a lot of sociocultural stuff going on that lowered his mood.
Now, reading the excerpt, you get the feeling that he felt that his academic issues carried a burden beyond his own career because he was one of the few, if only, Black students in medical school.
Exactly. That's right. And the dean was really, apparently, I mean, when he told me that the dean was one of the first people that called him when he read the story and was just so proud of him for speaking out like that. And he's had that kind of support now from just a lot of people. And is really carving out, as far as I know, a nice primary care practice, serving the needs of many marginalized patients.
Now, the response to him sharing his story was positive, as you said, but
Yes.
initially that wasn't always the case. I think that he had some discouragement in terms of sharing the story at first from publishing in a medical journal. Is that correct?
Yes, that's right. And not just Chris, but a number of other individuals I spoke to, especially students, and their mentors who discouraged them from publishing their stories are definitely well-intentioned. But they said, look, take that out. Take that piece out of your personal statement in your application to medical school. I think of Dr. Michelle Silver, who's featured in the book, and she wrote a wonderful piece in the New England Journal of Medicine about personal statements not really being very personal, because she talked openly in her person about having recovered from an eating disorder and that she was well, and she wanted to explain what that was like and how that has made her a more empathic physician to be. Same thing as she was applying for residency, she was discouraged from taking something out of her personal statement there as well. So when I reached out to her and interviewed her, she's gone on to do a lot of work in narrative medicine and speak openly, again, about the humanness of all of us, who study medicine. So as I say, they may be well-intentioned, but the point though is that the person reaching out to you, if they're pretty certain that they want to do this, then really give them your support. Yeah.
Now, do you feel that there's a cultural shift
Yes.
when it comes to authenticity? Because now we have, of course, social media and today's medical school, they grow up on things like Instagram and TikTok, where being authentic resonates with the audience. Has medicine come to embrace the authenticity of this new cohort of doctors? What was traditionally frowned upon now is better accepted?
Yes.
What do you think?
Yes, it's a work in progress, but it is moving quickly in a very encouraging way. I know that Dr. Bill Lines has been on your show before. He's someone that I've known for some time. He and I have done a couple of podcasts together. He's featured in the book. Jessie Gold is a woman, of course, who's very, very out there on social media. She was always also very gracious in being interviewed for my book, because what I wanted her to speak about was that hesitancy that she wrote about in a piece on social media about how she'd been very open about getting psychotherapy, but was reluctant to disclose that she was taking medication. So it was sort of like another little piece of stigma, and it freed her up to be able to just do that and to get that out there. And she's one, of course, who's such an amazing woman and has a huge following and in the work that she does. These are all beacons. These are individuals who are making it easier, again, for other people coming along. And I think it's making it easier too for the older folks, say of my generation, who are the ones who are very kind of cautious about this because they feel, look, In my day, you would never disclose anything like this or whatever. I mean, you know, you may not, first of all, you may not get in, but then secondly, you could be ostracized,
Mhm.
just for being kind of human.
And in the story, getting back to Dr. Veal, his candor definitely played a role in terms of the residency match process, right?
Oh, absolutely. That's right. Those are things too that I think training directors, and those are interview candidates for residency now too, as they read more of these stories and actually meet individuals, because some of whom are now on their faculties, that these are individuals who speak out. And once again, these are not people, that this does not take away from their professional role as an academic teacher, as a researcher, or as a therapist. These are just kind of facts and parts of their personality where younger people can kind of look to older as their role models in a much more, I think, broad-based way. So that's why this is all very, very exciting, and that's why I'm sort of hoping that this book kind of gets the attention, because it really is my way of honoring and thanking so many medical students and physicians across the globe for this gift.
We're talking to Michael Myers. He's a professor of clinical psychiatry, and we're talking about his book, Physicians with Lived Experience, How Their Stories Offer Clinical Guidance. There's an excerpt from that book on Kevin MD. Michael, let's end with some take-home messages that you want readers to come away with after reading your book.
Okay. One of the biggest take-home messages, and I've learned this actually from so many of these folks that I interviewed, is how important it is for you to thank them. Because even the ones who have gotten these emails, so many of them were so surprised. They thought, God, not only did I not kind of expect anyone to read it, but I never thought anybody would write me. And then, of course, the ones then that put their story out there, that's even more so. But just to thank you, it kind of reinforces, I guess I did make the right decision by putting it out there, by spilling the beans, so to speak. So that's really one of the major ones, is to really thank them. These are our colleagues, and they're just making it so much easier for other, and it could be us in our hour of need, where we would then kind of remember, he did this. I'm gonna speak openly too about my struggle with alcohol, something like that.
Michael, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Kevin. Great to be here. Take care.